Carissa Brewster. I am the staff writer for Whitman Partners, and welcome to the 2023 BIPOC Perioperative Leaders to Know Recognition Awards. Today we have Daphny Peneza, Perioperative Services Manager of Neurosurgery and Out-of-Bronch ORs at Vanderbilt University Medical Center. Welcome, Daphny.
Thank you, Carissa. This is an honor.
Thank you. Thank you for joining us today.
Well, perioperative nursing is really a dream. I was extremely fascinated as a nursing student when they brought us to the operating room. And I just really like the collaboration and the amount of energy and synergy that the team brings to ensure that a highly critical moment for the patients, because at the time I was in a trauma case, is delivered. So that the patient is, of course, will be safe. So that amount of energy really enlightened me to be the perioperative nurse that I am today. Well, discrimination comes in many forms, and it can happen in any stages too in the healthcare world. It can be like physician to physician, physician to nurse. It can be in any level of the medical profession. But the most important thing is once someone speaks up and it's brought up and properly in the chain of command and reporting system, it actually is nipped in the bud. And so any forms of discrimination will not progress in the future. So it all boils down on how members of the healthcare team hold each other accountable and also take care of each other.
So kind of fostering that environment of when you witness or see someone being mistreated, speak up.
It's very common for newbies, particularly for interns, for instance. And when I was a new staff member too, it can happen. But know that at the time, the person who got my back is my preceptor. And she was very helpful and supportive and reminded the members of the team, hey, she's new. She is still learning. And that support actually is very empowering. That, know that even if I was new at the time, I have an opportunity to grow. I have the opportunity to ask questions, and that my preceptor, which she became like my mentor forever, was there for me to ensure that I navigate and progress through the orientation appropriately and timely.
Awesome. For the last few years, there have been a lot of diversity, equity, and inclusion initiatives throughout all industries, including healthcare. The last year or so, it seems like that's kind of cooled down a little bit. Not that people are ignoring the need for DEI initiatives, but it just seems like the focus has been getting taken off of it. In your mind, what does DEI mean to you, and what does that look like in the OR?
Oh, the topic of DEI is very near and dear to my heart. As an internationally educated nurse who was born and raised in the Philippines and transitioned to multiple countries, first in Canada and now in the US, diversity, equity, inclusion means a lot to me. It really is essential to address the need of DEI, because nurses comes in many platforms, or we come to nursing right now, some straight from high school, you go to nursing, but there's a lot of people who transitioned from like a past like profession, for instance, to nursing now. And when you're internationally educated too, and you move around into different countries, it is particularly significant that this topic is addressed, because not only you're here to assimilate or to transform or re-navigate the new workplace, but also you are re-navigating the new city. At the same time, you may have like family in tow with you. And sometimes too, you may think like, well, this country speaks English and it will be the same language, but actually there's some differences when you transition from one country to another. Like Canada, there are certain terms that are really like Canadian focus, and there are certain terms that I know in US is a little bit different. And now that I have transitioned from one state to another, I also have realized that even in different states, I need to re-navigate and really stop and take a moment to really refocus on certain topics as well, that it is now part of my system, and that as well as I account it in day-to-day decisions. And
That's a
you've
great
also
point.
asked, yeah, sorry. You've also asked, what does DEI looks in the OR? Well, definitely it comes in many forms. Apart from the racial background, we also have generational, like different generations in the OR. We do have like 5 to 6 generations in the OR, I believe, in most ORs now. And at the same time, too, let's not forget that we are also working with a very diverse team. And so like physicians, PAs, nurse practitioners, CRNAs, it is really like different specialties, different profession, but we have to remember that it's like a tapestry. We are weaved by each other's experience and the diversity that we do bring to the table. And that type of rigor and energy, once we just find it out together, we will be able to create this puzzle piece wherein everyone is really treated well and growing well, all for patient safety and excellent care. Absolutely. So DA initiatives in every institution is now really empowered, like across the US setting, even worldwide. And particularly like the vision mission of the institution is significant. Like for Vanderbilt, for instance, we'll live and breathe with our credo. And so that's really like the Vanderbilt credo is very, very significant, and that alone protects and is really the biggest initiative of the institution in terms of addressing DEI. Another thing too that I know Vanderbilt is about to launch, and we are partnering with the Vanderbilt School of Nursing as well, is we are putting together it's like a leadership training for diverse population leaders. And so that's something too that I know it's in the process right now. And that's really a great initiative for Vanderbilt to actually raise nursing leaders that are diverse, with the support of not only the medical center, but also with the resources of the College of Nursing. Particularly, personally, my effort for diversity, equity, and inclusion in the unit that I actually oversee is very significant. For me, I know it's very diverse in terms of age, as well as the racial variances in my department. So I make sure that I give the opportunity for my team to be really heard through daily roundings. I do like personal one-on-one with my team. I give particular emphasis to the new grads or our nurse interns, and also giving opportunity for our orientees, those are still who are in the learning pipeline, to have an opportunity to really discuss and interact with me in a bi-weekly basis. I think that has really improved our strategy. With that, we have actually improved our completion rate into 100%. And right now, we have zeroed down our needs for RNs. Around December of 2022, we are 8 nurses down, and I'm so happy that we were able to fill in all of those 8 spots and have gained 1 additional staff member too. So it's wonderful.
Nice. That's awesome. Especially in these times where, there's a staffing shortage. It's a tougher environment to navigate.
Well, wonderful. Well, thank you so much. I am still very much this person. I'm just like 5 months old in this role. So I will just definitely walk you through to what do you think I have done. So it has been like really a whirlwind opportunity for me to join Vanderbilt University Medical Center. And I came from a really wonderful healthcare system to which is the Memorial Healthcare System in Houston, Texas. And I was an education resource specialist 3 for a level 1 trauma facility there. So know that when there's an opportunity that's knocking on your door, sometimes you will be stuck in a crossroad wherein should I live the job that I'm so comfortable with, or do I move up? Now, when I move up, what should you do? And so my biggest tip for the new manager is really, number 1, to find your why. And if your why aligns with the opportunity, then go for it, for sure. Now, once you have found that why, you have to make sure that you prepare. And preparation comes in many ways and forms too. But the best way to utilize is really reach out to your network of mentors. I am so grateful to have a lot of mentors that look after me through the years. And so if they're probably listening to this interview, thank you for all of your wonderful contributions, because I have reached out to a lot of key leaders across the country. Majority of them are perioperative nurses, but I also reach out to my other professional mentors too. I even talked to my high school teacher about this. Know that the more leaders you talk to about an opportunity, they will give you insight. But at the end of the day, it's still up to you, because you can't be easily bombarded with all of their thoughts, right? With all of the self-help books that they want you to read. But at the end of the day, it's just really up to you. And the biggest factor is really pace yourself. So to summarize, your why is your goal, your vision, but it's really up to you to pace yourself. And to be able to do that, it's a constant assessment and reassessment. And if you need to redirect your plan, you have to redirect your plan. Well, surgical care coordination is really significant. So whatever your role in the institution, know that you're contributing to surgical care coordination. And my perspective as a perioperative nurse leader right now is definitely way different compared to when I was like an educator. So like, let me just touch base with, although there's a lot of challenges when you are on the bedside care, when you are doing your job and taking care of your patient, you can help out with surgical care coordination, as well as when you are an educator too, when the faster and the smoother you can transition learners and keep the team updated with competencies, you're helping out. So the gist of this is everyone needs to know their swim lanes. So when I say swim lanes, when everyone masters their role and they do their best on their role swim lane, surgical care coordination will be a lot better. Now, as a leader, which I'm going to expand more, as a clinical nurse manager now, I am the bridge between the clinical team to the healthcare leaders. And my physician partners and physician leaders. So with that being said, one of the key things that I've already told you earlier that I really ensure on a day-to-day basis is daily rounding. So daily rounding, another thing too is involving the team in huddles, so safety huddles. So before I came into Vanderbilt, they already have like some huddles in place, but I have added a few huddles with the team. So I have like a brief huddle as well with my team members. And then I have like an electronic touch base around 12:30 to 1 o'clock before I report out in the manager 1 p.m. huddle, making sure that the things that I missed out when I joined like a couple of virtual meetings or in-person meetings, I made sure that my nurse managers or assistant managers can actually tell me. And then also too, I have added like a monthly team planning with my neurosurgeon triad partner and with my neuroanesthesia triad partner. That's a week before the pod meeting. So it helps us analyze and really put special rigor on key topics on our department. And that way we are prepared and ready to go once we deliver the information of, like our monthly stats and figures to the entire team. Well, I think that is really a special project of everyone, right? So first case on-time start is essential, as I have mentioned. And so it is a collaborative project of all. So what we do to help support this one is really make sure that we gather all data for the team and for the leaders too. And we report it out to the safety huddles. In that way, like, for example, if there's like missing supplies or implants or like there's certain issues with supply chain, I will be able to report out and at the same time get the appropriate answers immediately from the key leader of the department. Also too is the consistent rounding, not only by me, but by the other key leaders that I do have in the team. So that's my ST lead and my CSL or assistant manager goes rounding too. That really helps out. Really navigating to in a way that any free person in the unit or department is there to help out and support. So it's really keeping an eye of what we have at hand and just really beautifully executing delegation and putting strategies or policies in place so that we can handle FPOTS. Know that it will be a continuous process, and particularly as a new leader in a workplace where they don't have a manager for a couple of years, I think 3 years total. I've seen this specific topic as something that they need to work on, but we are constantly improving. And as we continue to actually gain our progression towards 100% staffing, we will be able to, it will be a lot easier because the world that we navigate where we previously had a lot of travelers right now is getting more, it's getting better. And at the same time, our FCOTS in the department is improving. And it's probably because the staffing is addressed. So, yep, it's a multi-step process, but so long as we have positivity and the willingness to collaborate and communicate together, I think we will be able to resolve it. Well, I currently work in a level 1 trauma facility, and in case cancellations is inevitable. But it is like a continuous process of, like I said, collaboration among members of the team. But I think what the additional recipe that I will actually add on to this specific topic is making sure that apart from training our nursing team is also participating in training our like residents, medical residents and medical fellows. When we participate in their training and they know the whys behind how processes are actually improved and why it should be done that way, they are more collaborative and they will be able to also navigate the process, and we will row as one. So with that being said, the more that they're informed and involved, the more that we will be able to prevent case cancellations. And particularly now that it's June, July is about to happen, we are actually starting to also onboard our medical chief residents and make sure that that key handoff among them is really addressed. So like as a clinical leader, you have to really involve your team. Like the biggest cost savings that we can really have is right now, I have to be very honest, is keeping your team. So when you have resolve completion rate, like staff orientation completion rate, it's not the end of the process. I know we are 100% right now. The next step is to also improve the recruitment rate while you are improving that completion rate. So it's safe to say that I have progressed and have put those checks in both too. But the biggest part is sustainability, and that is recognition of the staff. So all throughout, like, are we be able to keep the staff by recognizing them, by improving or making the workplace a healthy environment for all? And putting to account, am I also giving that recognition to myself in a way? Like, am I giving myself as a leader an opportunity to also relax and be able to have that innovative and creative mindset as well? Because leadership is not all about hitting all of these numbers, but also making sure that you account for enough time to rest and be able to recreate and deliver some of the innovations that will not only increase staff satisfaction, but also increase engagement among members of the team. So yeah, like that will be like the best thing, the triple R's, recruitment, retention, and recognition. And when that is pretty much taken care of, that's a big cost savings for the workplace. And then secondary is, of course, I will go to the reducing recycling, because OR is a garbage generator, right? So that's another thing too. And it's a multi-level process pretty much.
Yeah, retaining staff is huge because you can do all the work of getting the best people in, but if they don't stay, that doesn't really help the organization. Excellent. Daphne, thank you so much for joining us today. It was a pleasure talking to you.
Thank you so much. It is a pleasure, and I am very grateful for the team or the peers that nominated me. Thank you, and I look forward to collaborating with you as we continue to improve nursing and perioperative practice. Thank you.